All right, and thank you for the invitation. I would like to give you some experiences with the learning curve of navigated laser from our hospital with the focus on peripheral treatments. I would like to introduce myself. I'm Carsten. I'm one of the attending doctors here in the clinic, and at the moment, I'm one of the key users of the navigated laser over here. And we have some other key users that contributed to these results. For the laser, we have this laser since July 2020, and for the performance we did here, we had some simulated treatments via the iPad app, and we had access to the expert library from Navilas. We had simulated treatments on the installation day with the key users and other colleagues with a briefing later. First patient treatments were from end of July with the key users and some patients for appointments on those days. And we had a very high interest in the whole team to learn this sophisticated laser. The preparation for the installation week in our hospital, we started with the installation of the Navigate app on the iPad. And the first try was setting the caution zones here to secure the fovea and also the optic disc. This was the first task done by the team. And especially the younger colleagues had great respect for central treatments because they compare a laser with a laser sword, like in movies seen. But when you secure with the caution zones, the fovea and also the optic nerve head, I think they feel much better for also the central treatments. Therefore, we started with peripheral areas like here, a retinal tear with, you can clearly see over here. And we started with some single spot simulated planning over here, filled it to a rim of 3 borders, and also tried another approach with the area painter over here. Or this way, we had a look on different contours over here in the iPad app and discussed later the possible ways. This was the first approach over here. And the first planning of focal treatments for 2 users. Focal treatment is one of the main aspects of the new laser I personally perform a lot. Like the CRCS, here we have the caution zone of the optic disc, we have the caution zone of the fovea, and as you can see here in the fluorescein angiography, the sign of fluorescein coming out. So here is an active spot of CRCS. I really like the capabilities of the laser for the segmentation and also the registration of the fluorescence angiography with the current fundus image seen by the laser. You can see over here. So therefore, we can plan on the fluorescein angiography image, and the spots are also transferred to the actual registration we can see in the background. The first treatments of this was the preparation and planning phase prior to the treatments, and then we started with the first patient treatments. We had a selection of patients for training and learning of treatments. We started with peripheral treatments when possible because most people felt safe with the new equipment in the periphery, and the caution zones give additional safety. This is one of our first training patients, a young man with high myopia, peripheral degenerations, and left saclage and old pigmented laser spots you can see over here. Interesting for us is the other eye, where you can see a lot of lattice degenerations over here, and also nearly around. So this is a tricky patient because they are very widely outside, and it's a lot of work securing those lattice degenerations on the conventional laser. So we did the planning using those parameters here with different area zones that we secure every lattice degeneration over here, that the patient is hopefully safe from getting retinal detachment on this eye. And here we can see the results, wonderful spots around the retinal degenerations over here. This is another more demanding patient. We have a young man with a sickle cell retinopathy, also with ischemic occlusions in the retina, and a mild vitreous hemorrhage. You can see over here, and you can see degenerations over there, and also very good ongoing of the laser spots over here, and also in the areas with the highly degenerations and the vascular occlusions over here. Good outcome of the laser spots. So also due to the mild vitreous hemorrhage, I'm very happy with this result. I can see here on the autofluorescence. For the CSCR treatment, we have a patient over here. You can see the active spots over here. You can see the really wide area of this CSCR also over here. And it's the same approach as we did in the iPad app with the caution zones, and then the titration until mild burning spot. There are different approaches. If you like to use micropulse, or if you like to use the coagulative way, we personally use both. For the more peripheral one, like here, I personally like the coagulative spots, and for the central ones over here, I personally perform the micropulse laser with good outcomes. Yeah, you can see here after the treatment, this is now dry. Yeah, a word about the second pulse treatment. With the continuous wave laser, you will reach the coagulation threshold and perform a burning spot. This is good for securing retinal tears, or if you have a patient with diabetic and you would like to perform a pan-retinal treatment, then the continuous wave laser mode is the best choice. But if you have focal laser, or if you need a focal approach, lasering some micropulse grid around the fovea, or having diabetic edema near the fovea, not in the center, micropulse grid would be great. And also for the CSCR with spots, fluorescein coming out around the center, the fovea, the microsecond pulse treatment can be your first choice. Because for the micropulse treatment, you don't have a continuous wave, you have microsecond pulses, so that the tissue temperature does not reach the coagulation threshold. So there is a modulating of the retinal pigment epithelium, is modulating of the retina. There is something ongoing, but no coagulation. So this is a very good and I think a very high sophisticated treatment we also perform here in our daily routine. There are different approaches of doing this, different protocols that were published. We, in our clinic, we have experience with those both, and I personally also like those the settings over here. It's very important for the CSCR that you titrate in microsecond mode until barely visible burn, which can be also in an energy of about 900 to 1000 or more milliwatts until we get a barely visible burn. But you should have in mind that it's a duty cycle of 5%. This is titration in microsecond pulse. So you need a lot of energy to release a burnable spot. And then from the titration energy, you should take around 25 to 30% of the energy for your treatment in the fovea in the central area. Yeah, there are different approaches that are also already published, and we have a good experience also with those protocols given by the vendor of this system. What's the experience of the learning curve? From our key user team, after the first patient treatments, I asked some questions. Was it a big change from the standard argon laser to the Navilas? What did I find easy? What was challenging? Did I get faster over the time? How experienced am I? How would I teach someone to use the Navilas? How do I get to the right laser energy? Have I developed rules of thumb? Probably. Or where should you start if you are new to Navilas? I think interesting questions, and we get a lot of answers to them. So I make some choices for this presentation. Was it a big change from the standard argon laser to the Navilas? A longer preparation time for entering the patient data. Yes, it's true. You have to prepare the patient on the laser. You have to enter the data, but in some hospitals that have a PAC system, a picture cleave system, you can use the DICOM modality work list, so the patient data is transferred automatically to the laser, and also the laser protocol is transferred automatically back to your system after the treatment. No, not a big change. However, it's worth to click through the menu without the patient. Yes, you should get familiar with the system to know where are the different options you can use. It's also, I think, very beginner friendly because you have the main options directly on your laser system with buttons and with possibilities to enter there and not on the software. Safety of not shooting into the fovea. It's very beginner friendly because you can set caution zones. It's a very good alternative to the normal argon laser for many applications. Yes. But there are also some opinions they said for reduced visibility of hemorrhage in the vitreous. The conventional laser cannot be replaced, in my opinion. We also have the conventional laser still there if there were some sophisticated treatments, and also to have another laser with another wavelength here. I think it's good for the hospital. What did I find easy? Yeah, menu is very user-friendly. Everything from turning it on to planning, lasering, and importing images. I personally think a good advantage is that you can import a lot of modalities of images, like fluorescence angiography, that you can register them on each other. So it's possible for you to register on each other, and then you can control on the fluorescence angiography and transfer them to the laser protocol and to your current photo. What was challenging? Still also depending on the patient corporation. Get a high quality fundus photo. Yes, at the beginning it's demanding to get a high quality fundus imaging, but I think after the treatment of the first 10 patients, each of our team of the key users, we are still fine with this, and we are already, the whole team makes high quality fundus imaging for the treatment planning. Better one with more practice though. first session that to practice with the contact lens. Yes, it's very important that you're familiar with using contact glass, probably with the Grohmann contact glass in examination of the patients, because you will use a PRP 165 or you will use a superquad or something else on your patient for the central treatments and the panretinal treatments, and for retinal tears outside or specific central treatments, you will use the non-contact lenses from the Navilas laser. Yeah, learn very quickly. Assessment of whether laser spots are taking up sufficiently. Yeah, that's also cattling at the first approaches to find the right energy, if the laser spots are burned ready or not, burned in a good way or not. We have found in our clinic that mainly gray spots change color after some days, so they get darker. It's no need that you have a really white spot at the first approach. I would set the energy not too high for the first treatments that you have there away. So we played a little with different energies and did autofluorescence after some days. We'll have a look. Did I get faster with time? Yes, definitely. Now it's only 5 to 10 minutes for about 1,000 effects. It's very time saving. It's great. We have laser appointments here 3 days a week, and there were only 2 to 3 laser appointments possible in the Asian times over here. But now we have slots for much more patients because it's very time saving, this areas. Yeah. Also peripheral treatments quickly and safely, enormous time saving, yes, within a short time. Panretinal photocoagulations, yes, of course, 8 to 10 sessions being less than the time saved and the lasers themselves. How experienced am I? Yeah, within each panretinal photocoagulations, you get faster. It's very easy handling. Experience is quite good by now. Conversation takes time. Yes, at the beginning, a few laser sessions were not 100% successful, and especially for the energy setting, I still need longer than with the conventional lasers. But if you had figured that out, how the things are going on over here, then I think the learning curve is very steep, also in the first months. How would I teach someone to use the Navilas? Step by step with the individual steps, starting with getting to know the software, explaining the magnification glasses, need special attention, yes, can be planned together. And the next step, the treatment can be performed under supervision. Yes, of course. How do I get to the right laser energy? Yeah, gradual titration with the titration module of the laser for the first laser spots. Select the basic energy settings. Difficult to laser directly set high energy. Yes, there are some patients having problems with having the eye open or with having the contact glass inside. Yeah, and high sophisticated because do not have to be afraid of hitting the macula after all, because you can see directly where to plan and where to shoot. Yeah, when I see the spots, okay. Have I developed rules of thumb? I have noticed that usually more energy is required than specified in the available data, so I often start a little higher. Sure. Handling is too simple to develop rules of thumb. Okay, that's a good opinion over here from a colleague of mine. Where should you start if you are new to Navilas? Good question. Introductory videos to use from the iPad app, very helpful for me. Yes, as I explained at the beginning of this session, we had 2 approaches. The first one was to have a look on the expert library on the Navilas homepage to see the videos and the different instructions, and then trying to Doodle yourself with the iPad app, with the Navigate app, to get familiar with the system and the approach on the laser. I can recommend this, yes, to the first treatment. I would do so also. Learning by doing, standing next to it and giving instructions, yes. For learning, I found the classic see one, do one, teach one best. However, it is very helpful to have someone sitting next to me for the first sessions to operate the menus. Handling the touchpad with one hand was a bit difficult at the beginning. Yes, but you do not have to do so, because you can change the relevant parameters on the laser console, because there are the thumbs and rulers to do so. The controls on the laser itself are much faster. Yes, with the individual symbols means on the touchpad. This is also the point. If you have understand how to work with the laser from the console, you can reduce the handling with the touchpad during the treatment. Based on the feedback and experience, we expand our structured familiarization concept here in the hospital. First step, iPad app for learning at home. Additional cases from your hospital can be loaded, so you can perform your own planning challenge in your hospital, and check also for quality assurance, give to different doctors to have a look on how they plan, and also for training purposes. Videos and training material from Navilas. Also, if you have, if you feel unsafe with focal treatment and center, it's very good. Lasering with interlock removed. Yeah, this was a personal experience of mine, very interesting. I personally sat in front of the laser with the interlock removed. So the laser does not laser my retina, but I can see the way how it performs, because the aiming also went through the pattern. It was a very interesting experience for me, but don't try this at home without advice, and also without an operator of the Navilas company sitting next to you and operating the interlock removed. Peripheral treatments on the patients, degenerations, foramina, pan-retinal laser correlations, and the very high sophisticated things, CSCR, grid, and focal stunts, lasering near the fovea, which you should perform when you're familiar with the peripheral treatments and feel safe in using the laser. Yeah, thank you so much for your attention. And if you have any questions on our experience, the lasers, or probably you have personal experience you would like to share with us, you can get in touch with us at any time. You can see my email address. Thank you so much for your attention.